How do hearing specialists diagnose mixed hearing loss? Have you ever wondered how hearing specialists figure out mixed hearing loss? This type of hearing loss combines both conductive and sensorineural hearing loss, making diagnosis a bit tricky. Let's break down how specialists typically diagnose this condition. First, it's essential to understand the two main types of hearing loss. Conductive hearing loss happens when sound waves can't travel through the outer ear, eardrum, or middle ear. Common causes include earwax buildup, middle ear infections, or damage to the eardrum. On the other hand, sensorineural hearing loss involves damage to the inner ear or the auditory nerve. This can be due to aging, exposure to loud noises, certain medications, or genetic factors. Mixed hearing loss means a person has both types of hearing loss happening at the same time. The diagnostic process starts with a detailed medical history. The hearing specialist will ask about any potential causes of hearing loss, like exposure to loud sounds, infections, or family history of hearing issues. This helps pinpoint possible reasons for the hearing loss. Next, a physical examination of the ear is conducted. This examination can reveal visible issues that might cause conductive hearing loss, such as earwax or fluid in the middle ear. It's a straightforward step but crucial for identifying immediate problems. Then come the audiological tests. One of the most common tests is pure tone audiometry. This test measures how well a person can hear sounds at different frequencies and volumes. It uses air conduction, where sounds are played through headphones, and bone conduction, where a device is placed on the skull. Another test, called speech audiometry, checks how well a person understands speech in quiet and noisy settings. Tympanometry and acoustic reflex testing assess how well the middle ear is functioning. After these tests, the results are interpreted. By comparing air and bone conduction results on an audiogram, specialists can determine if there is a conductive component or a sensorineural component. Mixed hearing loss is diagnosed when both components are present. In some cases, imaging studies like CT scans or MRIs may be necessary to look at the structures of the middle ear or inner ear. This helps in understanding the underlying issues better. Treatment for mixed hearing loss varies based on the causes. Addressing the conductive component might involve medical or surgical interventions, like removing earwax or repairing the middle ear. For the sensorineural aspect, hearing aids or cochlear implants may be recommended. In severe cases, fully implanted cochlear implants could be considered. Overall, diagnosing mixed hearing loss is a thorough process. It combines a detailed medical history, physical examination, and specialized audiological tests. The goal is to create a treatment plan that improves communication and quality of life for those affected. If you suspect hearing issues, consulting a healthcare professional is always a wise step.